Okay, so today I will be talking about the final exam draft. My name is Prasad Swami, and for this project, I picked the book called Good Days and Bad Days: The Self and Chronic Illnesses and Time by Kathy Charmaz. Now, why did I choose this book? There's a couple of reasons, but the main one is because I am a patient of chronic illnesses myself. And this book has a lot of valuable information of how a chronic illness can actually shape your identity and how you can probably identify time or relate to time when having a chronic illness. And the people that will be interested in this book, it's a very interesting book because it has two ways of or two perspectives in this book. There's a perspective of a professional in healthcare that would like to know or understand better their patients, but also there's a perspective of the patient with chronic illnesses, having a book that will make them feel like they're not alone in this journey, that it could be very painful, frustrating, or other things that will come up into your mind, especially when you're talking about the identity of a person or the relationship with the time. This book was published in the 90s, so 1993. That's why, like, the theme of the presentation, I try to do a little bit of a 90s vibe. And the research, like I said, is like autobiographical or and intellectual. So it's two ways to see it. There's a lot of interviews of people going through the chronic illness, and there's also some insight and analysis of the chronic illness. After graduation, the author worked as an occupational therapist with patients with physical disabilities, and this is why she started getting interested in chronic illnesses and how chronic illness will affect a person. The main idea in this book was to figure out how people can make sense of having a serious chronic illness. So there are a lot of cases throughout the book. She made different interviews because she started doing just a couple of interviews. I believe it was around 55-ish interviews in the first research that she did. But then during that research, those people that she interviewed were more like referred by their own physicians or primary care doctors. And when she started doing the second portion of the research and she interviewed a lot more people plus the people that she interviewed before, it was a lot more of the experience of a chronic illness patients, because a lot of them were not even following up with providers. So they were giving the raw, real vision of the chronic illness rather than the first 50 patients that I believe that she described it in the book. Like, they were more of like talking about the chronic illness or a little bit more educated about the chronic illness, versus the second time that it was more of like the experience overall. And the main thing that she wanted to study was the identity of the person with chronic illness and how they perceive time. So on this book, it's very interesting because there's two ways of interpreter. Like I mentioned before, you can see it like the patient perspective or like the provider or professional healthcare perspective. But the author does share a bunch of questions throughout the book, especially in the beginning, so that you can keep them in mind while you're reading the book. And I picked some of them in the list of the ones that she provided to share with you. And the first one is how ill people make sense of slow times or symptoms. So she talks about how people that are going through certain symptoms or certain illnesses feel like the time slows down, like everything in slow motion, like they probably had to be bed rest for long periods of times and the days are take forever, or they have to use a wheelchair or other things that prevent them to just have a normal life, and they feel like the time goes slower. The other question that I also mentioned is what does it mean to have a chronic illness? So this is a big one, and it explains so much about the chronic illness and the like how to perceive the like as a whole, not only once again as the patient experience, but also from the providers or the healthcare professionals perspective. Another question, and it's tied to the identity part, it's when do they accept them? There are cases that patients do accept their chronic illnesses, but there are other cases that they do not. And she compares a bunch of different diagnoses and how different, not only the diagnosis, but if it's men or women, if depending on their age group, if they're a younger adult or if they're an older adult, how they process the fact that they have this diagnosis. Another question is, what is the time like during sudden crisis or certain outcomes? Once again, it goes to the time perspective. And during crisis or uncertainty, time sometimes can go faster, or it can go slower, or they can feel like they are stopped in time, or they can feel like it's interrupted, their time in life. So those are a lot of details that in the book will explain, and I will explain further. But it is very interesting how the author breaks everything down, especially with this too, that it's identity and time, that you will think that it's easy to explain, but they're actually very complex, and how a lot of things involve and contribute to their perspective of identity and time. The last two, it's what mirrors of self does illness provide, and also how does chronic illnesses affect the sense of self. So once again, it's that identity, like who am I after a diagnosis of cancer? Who am I after a diagnosis of lupus? Who am I after having a car accident and not being able to walk again? So those are the things that will come into perspective when evaluating what is their identity, and also how are they experiencing time, if they're getting ready to the end of time, if they are really in a mindset that this is just an interruption in their life, they're gonna get better and then they'll move on, or if it's just like their time stopped and the world is no longer continuing, if that makes sense. So once again, the perspective is person who is experiencing the chronic illnesses, and then the perspective of the author, she's actually the sociologist who studies, synthesize, and create interpretation of the experience. So the author does not have a chronic illness. She has worked with patients with chronic illnesses for a long time as an occupational therapist. She's had colleagues and classmates or workmates or people that she knows closely that have chronic illnesses, and she happened to be curious about it and just like dig a little deeper about chronic illnesses, especially the identity of the person and the time. The book gets divided in three main parts. The first part is the experiencing the chronic illnesses. So this part looks deeply onto the three ways to experience chronic illness and the perspective of the ill. So it talks more in depth of like the actual, like there will be quotes of different interviews that she will ask them specific questions about their experience or their identity around it, and they will explain how they feel. And you can tell depending on like it, they will tell you the diagnose, and then what are the answers of that specific patient, if they're midlife or mid-age, or if they're older, etc. So it gives a lot of details, so you can actually embody or really get into the story. And that's what it makes it so special, because yes, this is making some research, but you are also being empathetic or giving you the opportunity to understand it in a deeper level of, okay, yes, lupus, it is a autoimmune disease, there's no control, etc. Understanding how the person who is living with that, it's perceiving that diagnosis, is very interesting. I also want to point out, before I continue explaining, this was in the 90s. So we're talking about a time that technology and all of the tools that we have now were not there. We're talking about diagnosis that in this book, it will tell you things that are not, like, example, multiple sclerosis. I think it was one of the diagnoses that I had to look up for like newer research or newer information to understand the symptoms and all that. So back then, we all know that things that were involved in the autoimmune disease, they were probably not researched or studied, because if you go to all of the reference, they're all in the 1900s. There's not a single one after the 2000s. So that's one of the very interesting parts that I will actually use it as a comparison, because there's a specific topic about the perception of chronic illness itself, and I want to compare that with the now, because we all know that with social media, TikTok, Instagram and all that, a lot of people are more open of talking about their chronic illnesses, but in the 90s that was not a thing. So that is definitely a part that I am putting together to share with you guys, because I think it's very important how to highlight that evolution of time. But going back to the main parts of the book, the second part is problems in an everyday life. So we already saw in part one how they experience it. So now how that experience is going to affect their daily activities. So, going to work, doing things in the house, caring for others, etc. So this part explores the different experiences and examine implications of emerging self. So once again, this is a part that hits the identity part. Like, how am I able to do things on my own? Am I now bonded to somebody else or depending to somebody else to feed me or to shower me? Or do I need to go now to a nursing home because my husband died? Like, those are a lot of the things that will affect and impact the identity of the person with chronic illnesses. And then the last part is illness, self, and time. In the first two parts, it does talk about time, but it's more focused on the identity and how the perception of the self. This part, it has a little bit of everything, and then the time aspect is one of the key components. And it shows how the struggle for control over the illness and control over time is a struggle to control the defining image of self. So once again, if we think about a chronic illness, especially if it's uncertain or if it's, surprise or unexpected, I want to say, there's a huge aspect of feeling out of control. So that's something that you will be able to experience and see throughout the interviews and throughout like the answers the patient gives, because it not only talks about the struggle of the disease, but it mainly emphasizes the struggle of being them, being self, like being yourself with all these limitations, being yourself, and then all of a sudden you can get out of the bed, being yourself, and just, kind of living day to day, because you never know if you're gonna have a flare up, if you're gonna have a relapse, if you're gonna have a abnormal lab that will put you back in where you like what you passed, if you won't have movement, etc. So it is very detailed on how control over the illness and over the time impacts tremendously how the person can perceive themselves. So like I said before, in part one, we're going to see more of like waiting time equals lost time equals loss of control. So it's kind of like what I said before. It talks about chronic illness as an interruption versus intrusive illness versus immersion in illness. Those are terms that are well defined, and we're going to talk about further. But for now, that's like kind of like the columns or like the bullets points of the part. There's different ways of experiencing it, accommodation and accepting the fact that you're like the patient is not what they used to be. And that's one that you will see that it's not just one patient that feel that way, but it's something that repeats over and over throughout the book. Good days versus bad days is something that I put a couple of terms here that are very important to understand what makes or what difference a good day than a bad day. And once I get in something that is not specifically in a page, but it will, there's a section that talks about good days versus bad days, but then throughout the book, you will see that description or comparison of a good day versus a bad day. But things that kind of main things that will make different a good day than a bad day is productivity. Was the person with a chronic illness able to finish the tasks that they were supposed to? Were they able to keep up with the to-do list of that day? Or were they able to go to work or not? Were they able to go to school or not? Evaluating how productive the day was, it could make a day good or bad. Another thing is activity possibles. Like, can they take a shower by themselves, or they need somebody else to shower them? Can they feed themselves, or they need someone to feed them? Can they go to that Christmas party without feeling that they need 3 days to actually recover from it? Amount of control of mind and body. Are they able to control their body? Do they have control of their legs, or if they're bound to a wheelchair? Do they have control over their mind, or they keep spiraling while they're bonded to a bed? Like, those are things that makes a good day versus a bad day. Also the illness in the background, like illness in the background, and also degree of choice. Are you able to choose if you're going to stay at home, or are you being admitted to the hospital or to a nursing home? Are you able to choose your care, or you're in a point that you actually have no choice and you have to go to the route that the provider is telling you? Do you have a degree of choice on the food that you're eating, on the medications that you're taking? Like, those are the things that makes a good day versus a bad day. Explained in the book once again. There's a lot of other information that the author makes sure to just like give you the parts of the interview, and then give you the information based on why they're perceiving that way, or how she will perceive that patient is having that experience. This is some of the reference. Like I said, I did went to Mayo Clinic to kind of search for the multiple sclerosis, and I looked in another website as well, and there are a couple of differences. I might do just a slide of just the diseases that I found, like some differences, but that's not the main thing. And it also, the book has a whole vocabulary on the end of the book that has the different diseases with their definition or what they are. Once again, we want to keep in mind that it is in the 1993, so it might change. It might be more information out there. So it is very important to keep that in mind, so that if you want to learn a little bit deeper about the disease itself, then you can research. However, I do want to point out that the experience of a chronic illnesses from the people in the book from the 90s or 80s, it's pretty similar to right now. Because like I said, I am a patient of chronic illness, and I resonate so much on a lot of aspects that are discussed in this book. So it is very mind-blowing that still in 2026, there are a lot of things that people struggle back then with the perception of self and with time. And still to this day, it's a real struggle. So no matter the improvement on technology, no matter the improvement of research, that we know a little bit more about the diseases and stuff, being consumed by the illness and also managing the time and the perception of self throughout a chronic illness, it's something that it's very relatable. So if you're trying to understand a little bit better, if this is something that interests you, especially if you're going to the healthcare field, it's a very important book to learn and empathize with patients that you will see multiple times. Meaning, like chronic illnesses, it's people that have an illness for more than three months. I probably should have mentioned that in the beginning, but so those are the people that have cancer, multiple sclerosis, those diseases that they will have a second home in a hospital or a second home in a place with healthcare providers. So understanding them in a deeper level, I think it's key, especially nowadays, and especially knowing that they still struggle to this day with the same thing in the 90s. So I highly, highly, highly recommend this book for you if you want to understand chronic illness in another perspective that will probably make you a better human. And if you know that someone is struggling with some sort of chronic illness, this is definitely a book that they might need to read, because it'll make them feel like they're not alone, and it'll make them feel like this is a battle for all, and you're not alone in that battle of whatever you're going through. So I am very excited for the final video of this book. I hope you guys enjoy it, and I hope you guys feel the pull and the need to read this book, because I feel like it's an amazing book. But yeah, thank you.